provocative, all three presentations. We do want to take some minutes for some questions, but we also have some very patient last panelists that we want to get to, and they've been wonderful about not screaming at us for being a little over time. You have a crappy moderator, so. Linda, you get to ask a question. I wanted to ask the first one, but you go ahead.
Oh, no, I thought you were skipping over yourself in the interest of time.
No, in the interest of decency, please go ahead.
Okay, this is for Tennille. I wonder if you could just really briefly describe the waiver process for the CDBG. Like, does that get initiated only at the federal level, or can localities request waivers?
Only the localities and the states can request the waivers. They're asking HUD for waiver of a particular thing to enable them to accomplish a specific recovery objective.
Bob, per.
Just a quick clarification from Dr. Smith-Parker. How long of the word that came from mine is lag time. What is the length of time it takes from congressional appropriation of a response to when the money flows? Because it's a process of notice and comment and things like that.
I'm sure Secretary Donovan would like to point to Sandy as this is the model we want to see. So time-wise, Congress appropriates at the end of January, 7 days. The department announces the awards. So we're still talking first week in February. In March, we publish the rules for those communities and states. They submit action plans about some sooner, but 90 days after that. And then in about another 30 to 60 days, they start signing grant agreements and getting access to their funds. So all in from, if you go with congressional appropriation, which is where we start the clock because we can't move until then, it could be at its fastest 4 to 6 months. In previous years, we were nowhere near that. The lag time is much longer.
Karen, oh, I'm sorry, David.
Thank you. In reading the Sandy Task Force report, I was sort of happily surprised to see this statement. HUD is requiring CDBG DR grantees to adopt green building standards for replacement and new construction of residential housing. The question is, are you seeing any pushback on that yet because of the higher cost of building green? And then I had a quick clarification about normal CDBG funds versus these disaster funds.
The pushback actually came from legislators who were concerned that it would drive up the cost of recovery. We did not get pushback from the grantees themselves. Part of that is because several of the grantees in New York City already had forward-leaning green building requirements, and we think that was part of the success of, if you will, why there wasn't an absolute stop. But we did have initial legislative questions and concerns, quite frankly, that how that would affect the cost of recovery. But so far, we have not seen the pushback. It is just within these next couple of months, now that the rebuilding process has kicked in, taking advantage of this upcoming spring, that we'll see how they're doing with Incorporated. They've also required to do it, but we'll see how they're doing soon.
And has there been any cataloging of health outcomes associated with use of CDBG, either normal funds or disaster relief funds?
Good question. So because each of the grantees can choose if they're going to fund anything health related, there isn't a uniform baseline metric that says, even from counting the number of facilities assisted to the increase or decrease in the number of households who have this health outcome or that one. It's not, that data isn't there. The grantees will be able to show you their investments, but HUD isn't yet at the level of tracking that. With Hurricane Sandy, the strategy actually requires grantees to speak to health outcomes as it relates to building in resilience. And so now we'll get to see for the first time, and if that's going to build on a metric and outcome, what it is they're getting. Now that they're making these investments in healthcare facilities with their DR money, what are we actually getting? But we're just at the beginning of that. The strategy was published in August. The annual program will just tell you the number of facilities assisted, the number of people served in health programs, but not a specific outcome.
Elisa and then Barry.
Dr. Smith-Parker, question. You mentioned what I believe may be a great wealth of information for us within the applications that have been submitted to you for this funding. And I'm curious about outcomes, and you kind of touched on that a little bit, but have you seen in your experience, just right off the top of your head, I'm sure there's some superstars out there with some great programs with regard to health, which is what we're focused on here. And also, I'm sure there have been colossal failures. Can you talk about like one of each, kind of get us headed in the right direction as we take a look at those applications that you have?
I always note I'll protect the innocent or the nameless, but I'll speak generally as not to point out. So in one case, for success stories, we do like to highlight specific grantees. I actually think the Louisiana model proposes both a serious consideration for, wow, this is the way this should be done, but also questions about co-location. One of them is Louisiana looking at a strategy that didn't just incorporate, we're going to rebuild hospitals, but also recognition that hospitals were the health service center. They were clinic, they were everything, and that was part of the problem. So separating out those functions and putting what I would consider urgent care services differently and in different locations than their normal hospitals. That being said, there are some campuses where they're still located literally across the street from each other. So if there's a weather event, a disaster event that's sweeping through, the same two facilities are going to get hit again. And so I'm sure that's a concern, but Louisiana weighed heavier on access to services than trying to spread them out much further because the communities had been without such facilities and services for so long. The failures have been, I would say, plans that don't speak to health at all. We had a series of inquiries related to mold right after Sandy, and my colleagues in the Office of Healthy Homes are certainly partnering with HHS and others on that. But those who didn't speak to it at all in their plans, how could you not? It was a major flooding event that you couldn't miss it. Those were some failures, and they received some feedback from HUD, which is why their plans look the way they do now for public consumption. And it wasn't just in the realm of health, but just very key things like that. You just can't, you wouldn't imagine flooding without mold, so why not think of a housing strategy that incorporates that? It's actually very eligible, part of the rebuilding process, but they needed to tell people, and the public, quite frankly, that this is what they were addressing. And we had a ton of questions on that alone.
Barry?
Just a quick observation on Bopper's question, which was answered about what's the average length of time. And the only reason I want to make this comment is because this morning, in I believe the first presentation, it was kind of an alarming thing when you looked at the percentage of funds actually allocated and so forth. And the reality, I think, and you can correct me if I misspeak on this, but many of these programs, when they're turned over to the state, just logically take time, because in the case of New York, for example, after Hurricane Sandy, they're asking very fundamental questions about what should be done. And so there's an 8-month planning process because each of the communities has to participate and so on. So it looks terrible when you now, more than a year after the storm, you see a very low percentage of funds distributed, but when you look into the reason why, it kind of makes sense.
Stephen?
Yeah, I just want to make a comment to follow up on that even further. It's a situation when you have several months until the money gets to the state, and then the state has a process that it has to follow, and then you have reporting requirements, and you have plans and other things that the federal government would like to see in terms of how so you have to ask permission for how the money's going to be spent, basically. And before you can do that, you have to devise the plan, and you have to get the permission from the state. Then you go to the feds. Each of us grantees have a project officer that we work with, and then they run it through the internal process with PGO or whoever that they have to run it through in the federal agency, and then it comes back, and you add another 2 or 3 months on to when the money becomes available before you can actually spend it. And then if you've got to do an RFP for a contract, or if you've got to just write the contract, if you don't have to bid it out, you're still just a simple thing of writing a contract is going to be another 30 days.
So I guess where I'm lost here is, why wouldn't, if I'm in town X and I know I've got public housing that has old air conditioning vents and crappy heater systems that are spewing out allergens for my kids who wind up using emergency room services and spending the state Medicaid dollars up the wazoo. And I know that. So now I have this horrible crisis that has occurred. But I also say, hey, we've got a flood. We got a chance to reconfigure our public housing now. We're going to rip and run and put a proposal in for rational engagement. We're going to have a whole nother better enhanced public housing. We're going to get rid of the mold and the mildew that's new, plus the crap that was there before. We're going to save the governor $8 zillion in preventable emergency room visits for kids with asthma. And we have it all pre-planned, and we're ready to roll. Shoot that doggone thing in there. And yes, it does take time, Steve, but I think that what you're making me think, you've already got your pre-planning done, and you don't screw around here. And I can go back and, Tennille, make the argument to connect it to, well, here was this disaster, no question. The water's all over my knees, right? So, I mean, why don't we just get that kind of pre-planning done that anticipates these things?
So the best grantees have it done. I'll actually point to NYCHA in that regard. NYCHA knew what its vulnerabilities were pre-Sandy and found some new ones post-Sandy. So NYCHA is the New York City Housing Authority, largest public housing on the East Coast. And their focus has been very strategic. They've been frustrated, quite frankly, by the insurance side of this,
right,
and their ability to plug in their federal dollars. But they knew pre-Sandy what they had to go after. What Sandy exacerbated, quite frankly, was their population that was isolated. When the power went out, there were households who couldn't get downstairs because the elevators were down. And even if they could take the stairs, there were persons who had oxygen tanks. So that isn't normally part of the public housing infrastructure, but this is what they've learned post-Sandy. They're ready to go, but there are a bunch of other funding sources that have to come into play for them before they can tap.
We're going to do two lightning questions. Robert, real fast, because we got to get this other panel because they'll shoot us now.
Ask a similar question that I asked before. How representative is NYCHA of the universe of your grantees?
With the big six for Sandy, Connecticut, Rhode Island, Maryland, New York City, New York State,
No,
New Jersey.
no, nationwide.
Well, the HUD only funded 6 Sandy grantees. So of them, NYCHA has, if you will, the highest, if you will, level. The other grantees, because they are states, they are not normally engaged in the public housing discussion as if they were part of a city or a city level agency, and so they're having quite a different recovery experience, and they're not in the planning stage like NYCHA, but NYCHA's in a big city. Rhode Island is in a totally different circumstance.
1 of 6 is what you say, yeah. Last thing, Karen, real quick. I can't not lose the opportunity to come back. So you're engineers. Engineers are, you don't care about all this soft social service, health, blah, blah. Y'all want to build stuff and, you know, move earth around, right? Do y'all care about this stuff?
Yeah, absolutely. And I'll tell you why we care. Because you can't just build stuff and move the earth around if you don't work in the effects on the society and the community while you're doing that. And the community has to be part of the solution. After Hurricane Katrina, when we had to, we built a $14.6 billion improved hurricane, risk reduction system, around Metro New Orleans. We literally had a few thousand meetings. We were out in communities talking about what we thought we needed to do and asking them what they thought about it and getting input. And I could give all kinds of examples on that. So, even as engineers, the long-term planning, the stuff we're doing, the recovery we did from the floods in 2011 in Missouri and Mississippi, all of that involved tremendous public engagement to help with the solution.
Okay.
So absolutely, that has to be
one more thing. So who is the public that can get your attention? Is it the church leaders standing up? Is it the mayor standing up? Is it the public health department? What public gets you to listen?
Well, you know, it's all of that, and it really depends on what you're trying to do. You know, Louisiana is a great example because in Louisiana, it wasn't just the parishes and the parish presidents. It's really the communities and the neighborhoods, and particularly the churches. So we spend a lot of time with that, and for all the work that's going on, I give numerous examples in parts of the Midwest and those recovery, but in New York and New Jersey, the state governments, the local mayors are probably even more of a factor. But when we're doing things like the competition by design, you know, that had held up, or the long-term planning, especially with the civil rights that has to do with community development, it really depends on where the focus is, and then bringing in those groups. So they all, depending on the scenario, they all play different parts.
Thank you all very much. Great job. Thank you, thank you, thank you. And I cannot tell you how eager I am to get this transportation committee up here, because I don't think anybody has to be convinced around the notion of rational transportation and how it affects health, especially given that, by the way, the panel is supposed to be coming up. I can only feel so long. But no. The deal is that the physical inactivity numbers for America are still well over 20% of all Americans get no physical activity other than getting up and going to work. So it's 22%, by the way, if you want to know the number off the top of my head. So we really do want to hear how transportation is thinking about this. And we are happy that Herbie Lasad is here. Herbie is the chief of the Office of Emergency Management, the California Department of Transportation. And your slides are up. And Herbie, thank you for, first of all, being here and for your patience, but we have absolutely full attention on what you're saying.